All right, buddy. So we're here for our FUS chat, and it's always good seeing you at every single meeting. You're always smiling, and
Good seeing
then
you.
at the meeting and our board meetings, you always are filled with a breath of knowledge. But do you mind telling us about yourself and what you do, and
Sure.
what your favorite food is?
All right. I'm Terrence Regan. I'm a urologist, of course, in Palm Coast, Florida. But for the Florida Urologic, I've served as the Medicare Contractor Advisory Committee representative. I've also served for the AUA and the Health Policy Committee, Public Policy Committee, and a whole host of health policy things, which is what I really enjoy doing. And one of the things I like about this meeting is that they do put an emphasis on health policy and gives me a chance to talk with other people about it, maybe give my opinions on a few things. And I'm just so thankful for the Florida Urologic and how well they do in disseminating knowledge, not just for urologic care, but for health policy as well.
So what's really interesting is we have a lot of educational talks. We have a lot of new technology talks. This year it's about alternative pathways, whether becoming a CMO or
Sure.
private equity.
Yeah.
But we forget the most important part is the stuff that you like doing. So why do you think health policy is not something that people get excited about when they really should?
Well, I would say that it's been a long journey. I think that it's something that people are paying attention to more now than they used to, including the American Urologic Association, et cetera. I think for a long time there was a disconnect between what you do in the office as a doctor and how it applies to society and health overall, that we're really a systems-based healthcare issue, and that we're all just kind of one little piece of that pie, and that kind of trying to figure out the milieu that we practice in and how it affects us and how it affects our ability to take care of patients, to deliver the best care, the most up-to-date care, efficient care, is really starting to come into the consciousness of practicing urologists and practicing physicians in general. But I think that we're seeing more of that. That yes, that we tend to forget some of that issues. We take it for granted, but I think that over time we're kind of recognizing the importance of health policy.
So Terry, tell us, most young urologists are into RVUs. Well, how much am I going to get paid per RVU? What's my contract going to be?
Right.
The reality is the numbers that are set or the numbers you're negotiating have a large part to do with what happens from a policy standpoint. Is that correct?
Yes.
Am I right or wrong in that?
No, I think you're right. It's obviously a complex, multifactorial issue, but yes, health policy on the national level, how RVUs are determined, how Congress decides what they're going to update us each year, or how CMS is going to do it. Those are all kind of involved in the situation. So getting involved is very important. And what I would say, as we talked about a little bit earlier in one of the board meetings, was that we are really probably at a transformative time in healthcare with the upcoming administration, whether that's good, bad, good. I'm not here to make judgment on that, but there is an appetite right now for change in the way healthcare is delivered in the United States. So this is the time for us to be involved with that. So when you speak of young physicians and worried about RVUs in their contract, we'd like to get them to understand that the world is changing, the health policy world is changing. They need to be involved, that we need their input about how they think healthcare should be delivered and how healthcare should be paid for in the future, because I think that's incredibly important.
So it's interesting you mentioned this, because I will just tell you my personal opinion on this is I just feel like my voice is not as strong as a lobby from other organizations or entities. Is that true? Or is there a way I can kind of change that mindset?
Yeah, I would say that when you speak with members of Congress and senators, and we've had the good fortune through the American Urologic Association, the American Association of Clinical Urologists, LUGPA, all our organizations, we've been able to have contact with our representatives and senators. And what they want to hear more than anything else is what is happening with boots on the ground in terms of delivering care. That actually carries a very powerful message. So if you're not delivering that message to them, then they don't hear it, or they think that perhaps you don't think these changes are as important. So it is incredibly important for the individual person to talk with their representative, if they're able to talk with their senator or any of the affiliates in their office. yes, lobbying makes a big difference, and money makes a big difference in,
Yeah.
in the world. But I can't change that. Nobody can change that. That's why it's important to donate some money to your PACs and the like. But still, the individual message goes a long way. It really does go a long way, because if you speak, especially with representatives, they're really concerned about what's happening to their constituency in their area. So if they're having problems with access to care, they know they're going to hear about it from the constituents, but they want to hear it from the doctor's standpoint to see if there's anything that they can also do to help with that.
I know for me, I don't like doing these things, these meetings with Congress. I know it's important, but what I think is really cool is being a part of the Florida Society.
Sure.
I know you are our voice, or individuals like you that go and do this on this organization's behalf, our larger organization's behalf. So you may not like to do the individual stuff, but when you're part of organizations like this, you do have a voice.
Right. Yeah, well, it's a good point. I think that of course, we want to get a lot of people involved, and we need to get people involved and get their ideas involved as well. But yes, the Florida Urologic is very involved, and I will tell you, from Marty Deneen, who's my mentor, on it downwards, we've had a very good relationship with First Coast Services. That's here local, that is our intermediary that develops some of these local coverage determinations. And we've been able to influence a lot of those over the years. That allows us to really provide some of the breakthrough technologies for our patients without having too many restrictions on them. And it may seem mundane, but it really is exciting when we are able to convince a lot of the people who make decisions what's going to be paid or not paid for, why they should pay for this particular procedure, because we feel, and we have the evidence to support, that it really delivers better care for patients.
So your why, I can tell overall, is very strong. You really believe in this stuff. But not only that, you also are clinically very busy. You're also involved in your practice from a management standpoint, serving on the board.
Yeah.
How do you balance things?
Well, it's not easy, that's for sure. I mean, time management and organization are incredibly important. I mean, I wish I would have picked up some of those when I was much, much younger, because if you've developed those skills early, it's incredibly important. But you have to carve out time for yourself. You got to carve out time for your family. That's incredibly important. At the present time, my wife and I are empty nesters, so I have a little more time. I do think that's a challenge for younger practicing physicians, because they need to spend time with their families. And how do we carve out time for everybody to do all these things? And I think that is a continuing challenge. But I think, as you kind of mentioned with the why, when you really get excited or interested in something, that makes it much easier. But I really think, if we could teach one life skill to medical students or residents or people, is really that time management. They're pretty good at time management, but it's something that really kind of moves forward. And we have a number of people in our practice who are very good at working smarter, not harder. And that's another thing that I think we should teach to a lot of the people when they first come out of practice, is exactly that. For the exact reason you're saying, is that it's hard to do all these things, and learning these skills is incredibly important.
So I asked you what your favorite food was. You never answered it.
Yeah, not yet. Well, I don't know. I think Italian food is probably my favorite. I mean,
what's one hobby you have that we may not know? See, we like putting people on the spot.
Yeah,
we don't keep it just generic here.
I have a group that I road bicycle with generally every Saturday morning, or at least try to do at least once a weekend. We do 20, 30 miles. I really enjoy that. So.
I don't meet many urologists that bicycle because they worry about prostate pain, but that's a conversation for a different.
I got a very padded seat, and I don't go too bad. I only go about 30 miles, no farther than that. So yeah.
Well, Terry, thanks for everything you do. If you have
thanks. No.
Any final thoughts or comments or inspiring quotes?
No, well, I just think that, hey, look, you're in a great field, urology. Medicine is going to change from wherever you are in your career. The medicine's going to continue to change. Healthcare delivery is going to continue to change. Be a lifelong learner and keep with it, because it's a great specialty, and we're all blessed to be in it.
Yeah. Well, thank you so much for joining us today, Terry.
No
Appreciate
problem.
it, man.
Okay.
Thank you.